and welcome to Look Down There, the show where we talk about all the things we don't talk about. I'm your host, Michelle Lamore. Today is the final episode of season 3, and I am so excited to have this topic on the show because I've wanted to have it on the show since the very beginning of Look Down There. We're talking about pelvic floor health today. My guest is an orthopedic physical therapist with a specialty certification in pelvic health rehabilitation. She has been practicing pelvic health physical therapy for 5 years and currently works in the outpatient rehabilitation group at a public hospital in Seattle. She specializes in the treatment of women, men, and transgender pelvic health dysfunctions, including bladder and bowel dysfunction, pelvic and sexual pain, and pregnancy dysfunction. She is passionate about the role the pelvic floor plays for a healthy body, allowing us to improve confidence, sexual health, and quality of life. Here she is. Welcome, Jen Niemeyer. Hi, Jen.
Hi, Michelle. Thank you so much for having me on.
Yes, I am so excited to talk about this. This could be a very long podcast, but I'll try to keep it short and sweet because I just have so many questions. But let's start with the first one, which is, what is the pelvic floor? What does it do? And how come we don't really know about it?
Yes, all very good questions. The pelvic floor is quite simply a group of muscles. If you imagine your pelvis is like a bowl, the pelvic floor group sits inside and just outside the bowl of the pelvis. And it's there to support the body in many different ways. The study of pelvic floor health is a relatively new study when you think about the world of medicine. It's only until sort of the 1950s that they started looking into the pelvic floor, studying women, the role of incontinence, issues like that. And it has slowly grown from there. So, and I'm sure many other reasons why we don't talk about it. It can't be seen as part of female genitalia, that sort of thing.
Yeah. I mean, I can hear about it in exercise classes, like in yoga, engaging your pelvic floor, but it's never really talked about, like, what that actually is and what it's doing for you. So what brought you to this work?
My work history is a bit convoluted. This is actually a second career for me. And I knew when I was looking to change careers before I worked in the film and video industry. And so as I was looking for something, thinking about what did I want the rest of my professional life to be? I wanted something that was very supportive to women and helped women to better take care of themselves or their health or their life. And I didn't know exactly what that looked like, but I knew that I wanted that to be an integral piece to it. And found myself in physical therapy, loved the profession itself. I was very fortunate in the school that I was able to go to, the program. And in the program, 4 of our professors were women's health practitioners. So I was introduced to pelvic floor therapy or women's health therapy very early on. And in doing a little bit of research, talking to my professors, I immediately knew that was it. This was the thing that I had been looking for.
Yeah, this may be a question for later, but it's something that I keep seeing in all of, as I look at people who do this work, pelvic health work, a lot of it, it's very gendered. It's like, why is it only women's health? Like some of the accounts I see online talk about lady bits and, and we all have pelvic floors, correct?
Absolutely.
Yes.
We all have pelvic floors. And aside from like a few tiny little things, they are identical.
Yes. So is there discussion among your community of therapists about the name of this, that because it's always like women's health, and it's
Yes.
never, it can just be called like pelvic floor health, right? Or
Yes.
pelvic health, or
Yes. Yes. Our professional academy just recently went through a name change. So our professional academy used to be Women's Health Physical Therapy, and we're under the American Physical Therapy Association. Couple of years ago, maybe 2 or 3 years ago, we had a formal name change to the Academy of Pelvic Health.
great.
So yes. So now we are much more inclusive for our male population, for our transgender population. I think it's our history, our beginnings were focused on women, and specifically pregnant women, and how to better support them during and after pregnancy. And so that's why we got the name Women's Health, and we've grown from there, and we're slowly getting there. So among my fellow practitioners, we are very much pelvic floor therapists, and
Great.
not women's health therapists. Yeah.
Love it. Good. You can tell some of the people who are out on social media talking about this
Yes.
stuff. It really bothers me. I'm like, come on now.
Yes.
Yes. So, okay, what does the pelvic floor do for all of us?
So pelvic floor, in general, supports bowel and bladder function. So it helps you to maintain your continence, your bladder continence, bowel continence, gas continence. You need to have good control of the pelvic floor when you have a bowel movement. You need to be able to sort of relax and lengthen the muscles, so you're not straining or don't have pain. It supports your genital organs, or your pelvic organs, I should say, your bladder, your bowel, your uterus. It works really hard during pregnancy, supporting the growing uterus. And it has a big role in sexual function as well, in helping to have orgasm, that arousal, orgasm, all of those.
Yes. So stronger pelvic floor, stronger orgasm?
Absolutely.
Yes. Okay.
Yes.
Is
Exactly
there such a thing as having too strong of a pelvic floor?
Very much so.
And what would cause that? And what are some of the symptoms of that?
Yes. So we don't look at it as too strong of a pelvic floor. We look at it as more of a pelvic floor that might be in spasm, or like a hyperactive pelvic floor. So the muscles are like any other muscle in your body. It's a skeletal muscle. You have voluntary control over it. You should be able to contract it. You should be able to relax it. You should be able to lengthen it, much like you do your biceps or your quadricep muscle. And if something is not quite working right, if there's some irritation in the pelvic area, sometimes those muscles can go into a guarding state. So they will tighten and not release that tightening. So I'll often say to my patients, think about when you're trying to carry groceries in to the house, and you only want to make one trip. So you load up the arms with 20 bags. You're trying to walk into the house, and your bicep is burning because you're carrying a gallon of milk and a thing of water and all the groceries, and the bicep is burning and it's really painful. It's a similar thing to your pelvic floor. If it's tight, if it's overactive, that's what's happening.
So it doesn't really have anything to do with your physicality so much, like athletes, like working out all the time. It could really be related to anything, maybe just not feeling safe. Do you find that a lot of people who experience trauma or assault have kind of an overactive pelvic floor?
Absolutely. Definitely, we see a lot of patients with trauma. It could be a sexual intimacy trauma. It could be just a car accident, something where, the body is reacting, and you get this overactivity happening. So it could be that we do see actually a fair amount of athletes as well. And I think that has less to do with it's not so much a trauma thing, but more of a way that you coordinate your breath, an imbalance. It could also be the pressure of being, a college athlete or a professional athlete, where everything just tightens up. And that's where you hear about high school girls who have incontinence. So they're very young, athletic, very fit. You wouldn't expect somebody to have incontinence, a basketball player or a gymnast, but it actually is very common.
Oh, so I was actually thinking while you were talking, like, oh, okay, you can probably tell if your pelvic floor is weak because you're experiencing incontinence, but you actually would experience it either way?
Yes.
Oh,
Yeah.
I did not realize that. Okay.
Yeah. It is much more common to have incontinence if your pelvic floor is weak, but it can also happen the other way. Absolutely. Because the pelvic floor, that muscle group that's inside your pelvis, needs to be able to react. It needs to be able to tighten to help close down the urethra and support the urinary sphincter. If you cough or sneeze, or if you're jumping, things like that. And if your pelvic floor is already tightened, it can't tighten anymore to then resist that pressure. And so you can get leakage. Absolutely.
Wow. Okay.
Yeah.
What are some other symptoms that would be associated with either a weak or a hyperactive pelvic floor?
Yeah. Pain is another big one. So pain with intercourse is a really common one that we see, yet women don't realize that is a symptom that they have an overactive pelvic floor. A lot of women maybe have always experienced pain with intercourse, and it shouldn't be painful. All things being equal, it shouldn't be a painful thing. It should be a very enjoyable thing. And some women have never experienced pain-free or enjoyable intercourse. Another thing is if you have difficulty wearing tampons, that's another symptom that things are overactive.
Yeah.
Weakness, the urinary incontinence is usually the first sign. Coughing, sneezing, that's usually the first clue that, okay, wait, I have some weakness there that can easily be corrected as well.
Yeah. Yeah. Well, it's easily corrected if people can talk about it.
Yes.
Right. If they can kind of get over that shame to talk about it, because there's, we live in a Band-Aid society, and, rather than talk about it, we'll just go and sneak into an aisle, or you don't even have to go into an aisle. You can order on Amazon and get your incontinence garments, and never really have to talk to anybody about it.
Yes.
So when we think about, or at least when I think about pelvic floor health, I think about Kegels. So let's talk about Kegels. I know pelvic floor health is much more than Kegels, but I feel like Kegels gets all the lights and glory. So let's talk about them. Like, what is a Kegel, and how actually do you properly do a Kegel, and how often should you do one?
Yes. All incredible questions.
And is it possible to say the word Kegel without doing a Kegel?
For me, no. No, not anymore. No, not anymore. It just happens. My body's like, okay, I'll do it. So a Kegel is a pelvic floor contraction. So Kegel is the name of the doctor who discovered that if you strengthen those muscles of the pelvic floor, it can reduce incontinence in a woman. So Kegel, pelvic floor, they are the pelvic floor contraction. They're the same thing. So how to do them properly. So this is often how I will tell women to do them. When you're doing a pelvic floor contraction, nobody should know or be able to see you doing it because everything happens on the inside. So if you try to do it and you're squeezing your butt together, your cheeks together, if it's all coming from your tummy, if you're squeezing your legs together, you're not doing it right. It has to be, it's on the inside. And the way that I will cue women is I want you to think about if you have gas. If you have some gas and you're like with your girlfriends and you don't want that gas to come out, what do? You kind of squeeze on the inside and try to keep that gas in. That's you activating your pelvic floor muscles. And that's it. Some women, I will say, the connection with their own body, with their pelvic floor area is not there. They have a really hard time finding that, connecting to it. Some women have no problem at all. You say that and they're like, oh yeah, I do that all the time. I'm cool. I got it. And that's great. Some women have a real challenging time. And so if you can do it, the sort of general guidelines that we will share, that we will tell women to try to go for, is to contract and hold for about 10 seconds and repeat that 10 times in a row.
Okay.
And if you can't, let's say you try to do it and you're like, oh, I can only hold for 5 seconds, or maybe I could do it 5 times in a row, but after that, it becomes really difficult for me to contract it. It's okay. That's where you are now. And keep practicing, keep working to try to reach that 10-second contraction 10 times in a row.
Is it possible to feel orgasmic while doing these? Because I feel that I have done them and I've been like, whoa,
Yeah.
can't really do that in public.
Yeah. Yes, you can. So when you contract that area, you can get clitoral stimulation. Yes. And again, some women have a maybe more sensitive, a highly sensitive clitoris. Some don't feel anything. And so, yes. So by contracting that pelvic floor, you could stimulate your clitoris.
Yeah. I've noticed it recently. If I'm doing push-ups, I'm like,
yeah.
Whoa. Do you think that would mean I would do more push-ups? But I don't.
No.
I don't. I dislike them very much, but yeah.
Yeah, well, it's kind of getting deep into the anatomy. There's kind of 2 major layers. There's a superficial layer of the pelvic floor and a deep layer of the pelvic floor. So when people talk about Kegels or pelvic floor contractions, they're talking about that deep layer. But the superficial layer is actually really quite important for sexual function. So you have 3 muscles. The bulbal cavernosus is one of the muscles that kind of wraps around your vaginal opening. And that muscle will help with the erection of the clitoris. And then you have another one that's on the side. If you imagine a triangle, you have your vaginal opening. The one around the vaginal opening is the bulbal cavernosus. The one sort of on the sides, that is the ischiocavernosus. And that one is really responsible for helping to maintain that clitoral erection. So those superficial muscles are really important for sexual function, arousal, orgasm.
Nice. Interesting. Okay.
Yeah.
So, what kind of tools do you use? You were mentioning working internally versus externally. What would the difference in that be?
So if you go see a pelvic floor therapist, they should do, if you go for some pelvic floor dysfunctions, they should do a pelvic exam. And what that is, so if we're talking about a person with a vagina, you would do a vaginal exam. If we're talking about a person with a penis, you would do a rectal exam. And it's a single finger, so a single gloved, lubricated finger into the vagina or the rectum. And through the walls of the vagina or the rectum, you can feel the pelvic floor layer. I can feel those muscles. So then what happens is it's a little different than going to your gynecologist, because it's not that I need to do something on you. I'm basically a tool to help you learn your body and to know what is happening. So I give you feedback on, okay, I'm going to have you contract, and, sometimes people who can't feel their pelvic floor, you can affirm for them, yes. Do you feel that? Do you feel where my finger is? Can you feel yourself contracting that muscle? That's your pelvic floor. And that's what you need to sort of connect with. And so we do an internal exam to assess the qualities of the muscle. So the things that we're looking for is like your contraction strength, your contraction endurance, your repetition endurance, but then also how well can you relax that muscle? Because that relaxation piece, again, sort of going back to pain, if you're not relaxing and just contract, it's going to become overactive, and it will potentially lead to pain.
Okay.
Yeah.
So in terms of relaxing it, that would be like the lengthening action.
There's kind of two pieces to it. There's relax after the contract. So if you think about, you contract, you're lifting it up, and then a relax is letting it return back to neutral.
Okay.
And then the lengthening is a separate piece where you kind of give a gentle bearing down around the anus area.
Okay.
Yeah.
Just the anus area? Now I'm really thinking.
I know.
Okay.
So, yeah, it's like the perineum anus areas where you want to focus. Sometimes, and this is getting into like the little nuances of what we do. Sometimes people can bear down, and they bear down quite strong. But if the pressure or the force of that bearing down is more towards the front of their body, where their bladder is, they could be getting a lot of pressure put on the bladder, which we don't want, because that could encourage some maybe prolapse and stuff. We want the pressure to be more at the back towards the anus, because we're helping to have a bowel movement. That's what that motion is for.
Gotcha.
Yeah.
And what about, so I know, you use yourself as a tool. What, anything else? What about yoni eggs? Have you used those? What are your feelings on those?
So, haven't used those specifically, but I do have patients who come in because they've bought something online. They've bought vaginal weights, or they've bought, I think, quartz eggs. Really popular. Yeah. And they've brought them in, and they've been like, I don't know what to do. It's not working. I can't keep it in, or something like that. And so I will teach them how to use them. So we do the exam first. Let's see where your pelvic floor health is. What are you trying to accomplish? And then we incorporate whatever the patient wants. Sometimes they, there's like little sex balls that they'll bring in. And if they want to practice their pelvic floor contractions with those, absolutely. Let's talk about it. Let's bring it in. There's also devices out there. There's the PeriFit. There's the Kegel. And LV is another one. They're little devices that you insert into your vagina, and you have an app on your phone, and you practice.
Oh my gosh.
Yes. Yes.
That is really high tech.
Yes. And somewhat, because I get a lot of people asking, they'll hear about it, and they'll say, oh, well, do you recommend this? And if it's something you're interested in, and if it's something that's going to help you to remember to do your pelvic floor contractions, absolutely. I fully support you. But if you're not really a tech person or a phone person, and it's not a magic wand, it's not going to do it for you. You have to do it. This is just something that might help keep you active in it.
Okay. All right. So, there's this thing that we as vulva owners need to have tight vaginas. Yeah. So this is more than just about having a tight vagina, correct?
Exactly. Yes. Yeah. Yes. This is definitely, this is for your overall health, not just for a partner's preference. Yeah.
Yeah.
This is about you. Yeah.
Yes.
Yeah. Yeah.
So when you go, when anyone goes to see a
Yeah.
gynecologist, do they have this type of training? Like they do a pelvic exam, would they be able to tell like, oh, you know what, you need to work on this. This is feeling weak, and refer you to somebody? Like,
Yes. Yes. Absolutely. There are. It's funny because some gynecologists or urogynecologists, obstetricians, they will do a pelvic exam and they will ask the patients to squeeze and they can sense, oh, like nothing's happening or they don't know what they're doing. And I've had patients feed back to me that the practitioner will say, oh, go do Kegels. And the patient will say, well, I don't know how to do those. And I think the practitioner doesn't know how to instruct at times because they will say, go look up on the internet.
oh my
They will tell
God.
you, which is not the thing that you should be doing. So, and I will say that there are a lot of practitioners who are, who know about pelvic floor therapists who absolutely support the work that we do and refer patients. But we get a lot from gynecologists, urogynecologists, and obstetricians.
Yeah. Does your field struggle with validity within the medical field?
No, actually, I don't think so. I find that, I wouldn't call it validity in the work that we do, but I find some practitioners, you take like maybe a surgeon, like a colorectal surgeon, and they know that we're around, they know the stuff that we do, but I think it's just they have a different focus. Their focus is on surgery, not nutritional health, not pelvic floor health, not how can all these play together. It's more about there's a problem, I can take it away for you.
Right. Again, kind of with the Band-Aid and not talking about the root of the problem or going deeper, so to speak.
Yes.
But yeah, treating this as a holistic thing. And we're so far removed from treating ourselves as holistic beings, right?
Yes,
that
absolutely.
all of, like you mentioned, your passion about this work around the quality of life, and if you're having these issues, your quality of life is not that great. You're probably not feeling very confident, leaving the house or whatever, but then that's just compacted with the shame and not knowing who to turn to, and having practitioners that don't give you good information and leave you out, because leave you alone because they don't want to say the words or whatever. I don't know.
Exactly.
I mean, I've told you personally that I've had issues with a doctor calling my labia, my bottom. I almost flipped the table.
Yes, which of all people, you should be able to say the words.
Oh my gosh.
Yes. If a patient comes in and calls it their hoo-ha or their vajayjay or whatever cute pet name, that's fine. That's, it's, you can call it whatever you want. It's a safe space. But I am going to call it your vagina or your vulva or your pelvic floor.
Yeah. You know what? Shame needs to be removed from the medical environment.
Yes.
I was just at the doctor the other day and I overheard the nurse or the doctor knock on the door and ask if the patient was decent. Oh. And I was like, oh, yeah. So now we're just perpetuating the idea that our naked bodies are indecent. Yeah. And I understand that's maybe they're thinking it's a polite way to ask if their clothes are on or
Yeah.
if they're
Very
ready,
old
if they're
fashioned.
ready, to come in. But shame is so pervasive and it's
Mm-hmm.
so sneaky like that. Like just
Mm-hmm.
saying
Mm-hmm.
that, it just really stood out to me, are
Yeah.
you decent? And
Yes.
just continuing that shame that we have as, especially as women who struggle with body image and getting
Mm-hmm.
told that our bodies are indecent all the time, with that shouldn't be
Mm-hmm.
happening at the doctor's office.
No, no. And I feel like there's so much shame, and shame is often what will prevent women from coming in. And it's shame with, the exam process of needing to, like, as part of this healing process, you need to be in connection with your body, and some women aren't ready for that. It's easier just to ignore it. And there's also the because it starts out so small. It starts out as just a drop. Oh, it's okay. It's just a little drop, and I can deal with that. It's fine. And a lot of sort of female family legacy. Well, my mom has leakage. That's just what happens. You have a baby, and my mom leaks, and my grandma leaks, and my auntie leaks, and it's just part of being a woman. And when actually it's not. It's not something that is normal or something that you have to have.
Yeah. Someone who might be listening to this and feeling like, they're kind of struggling but don't know where to turn to, what would be a good first step to finding someone that they're comfortable with? And how do you make people feel comfortable?
Yes, that's a really, really good question. I would start off with, if you feel like you may have something that you want to get looked at, you could always ask your PCP, ask your gynecologist who they refer to. Because usually a practitioner is not going to keep referring to somebody that is not a good provider, especially for something like this, that it really takes somebody who can connect with people, who could work at a person's own pace. And I will say, in every pelvic floor practitioner I have met, we all tend to be very compassionate therapists. And the way that I am with my patients, you kind of know, that first meeting, the first time they come in, patients tell you either through body language or through eye contact, or sometimes they just come out and say it. I resisted making this appointment for 4 weeks because I'm so nervous about it. And so, intuitively, okay, we need to sort of take it slow. And I try to educate to make people feel comfortable, make sure that they know what to expect, and that we go at your pace, whatever that pace is. It's not about me. This is about you.
Yeah.
And that's how we do it. That's how we take it. And we don't have to do an internal exam, to be completely honest, because some people are very, very resistant. They're like, my doctor sent me here. They didn't tell me anything, and I'm not happy about it, and I don't really want to be here. And so that's somebody who's not really going to be very open to having a vaginal exam. And you explain that to them. You have to get consent. And in order to get informed consent, you have to tell them what they can expect, what's going to happen. This is what the exam is going to look like. You don't have to do it. For best results, this is my recommendation. But if you don't want to do it, I'm not going to do it. I'll do everything I can in my power to help you figure it out within the limits that you're willing to give to me.
Yeah.
So.
I like the phrase moving at the speed of trust.
Yes. Oh, that's a brilliant phrase. Yeah. That's really good.
Yeah, that's great. So I wanted to ask, like you were saying, this runs in my family, whatever, is incontinence an inevitability for all of us?
Ooh, that's a very good question. So I say no, it shouldn't be. No. And so it's very common if you are young and have had a vaginal delivery. Very common. I treat a lot of women who have never been pregnant, have never had children, no vaginal delivery, nothing, no vaginal trauma, nothing. But perimenopausal, postmenopausal, now suddenly they're having incontinence and don't understand why. So incontinence is very, very common among women. But
and with this work, it is treatable, reversible.
Absolutely.
Yeah.
Absolutely treatable. And I would say for I don't know, maybe 80% of women, you can eliminate all of their incontinence. And then it's up to you to kind of keep up with it, to keep working.
Very cool.
Yeah.
Yeah. And as you were talking earlier, I was thinking, wow, isn't it interesting that women will go and, I will say gladly, maybe not gladly, go and get waxed. But we can't go and do this. I mean, to me, waxing sounds much more horrifying.
And a lot more painful.
Yeah, I've never been waxed. But like they do it all the time, and maybe, I don't know, it could be for themselves, but maybe it's for a partner. Maybe that's the motivation. And maybe that's like the disconnect, is that like, this is for you, right?
Yes.
And doing things for ourselves and, really honing in on our self-care in all its forms can be very challenging.
Yeah, that's a really good point. What is the motivation? If you're feeling pressured by a partner versus doing something that is good for you, is for your own health, it's different. I will, like, I have gone and been waxed, and you are just laid out for the world to see. But in pelvic floor therapy, while it is extremely intimate and you're in a very vulnerable space, having somebody with their finger inside your vagina, it is much, much more modest than people expect it to be. Because we have a towel covering you. I'm sat beside you. I'm making eye contact with you the whole time. So it's definitely a lot more modest and a lot more comfortable than an experience of going and getting waxed.
Yeah.
Which I think a lot of people don't realize.
Yeah, no, I got up the courage to try it one time, and she gave me the paper underwear and came back, and she's like, "Oh, it's not long enough." And I was like, "Okay, bye." Never coming back here again.
Yeah, it's crazy. It's crazy. Yeah. But and that's it's funny when you think about it that we will do that, but we feel very uncomfortable going and seeing a healthcare practitioner about our vaginas and our pelvic floors and things like that. Yeah.
Oh, lots to think about, lots to unpack, but thank you so much for being with me today and talking about all of this good stuff. If people are not in Seattle where you are, where can they find a good provider?
Yes. So the Academy of Pelvic Health has a database that you can find. You can search by your area and find a provider in your area. So that is definitely one resource that you can try. So it's the Academy of Pelvic Health. If you kind of poke around, it actually is right up there. It says find a provider in your area. But sometimes if you maybe live in an area that doesn't have many options, you can always ask. So the physical therapy clinics in your area will say, like on their website, if they have pelvic floor therapists or women's health therapists. And you can ask. And my recommendation would be to ask about the training of the pelvic floor therapists, if they have been trained to do the internal exams. Not that they have to do it on you necessarily if you don't want them to, but do they have that training?
So that's a good marker that they're qualified
Yes.
and know how to do the work.
Yes, exactly.
Okay.
Yeah, because this is all education that is done after our licensing education. This is all postgraduate specialty education that you have to do.
Gotcha. All right.
Yeah.
Wonderful.
And then
Wonderful.
find a provider that you bond with. If you feel like, I don't really like the vibes of this provider, we are not offended in any way. Find somebody that you bond with, because that's the only way that you're going to feel comfortable enough and relaxed enough to share what you need to share and to get the most out of the experience.
Yes.
Yeah.
All right. Well, thank you so much. I hope this work is very rewarding for you. It seems that it excites you.
Yes, it is unbelievably rewarding for me. And I love my mission in life now is to talk about the pelvic floor.
Awesome.
So Michelle, thank you for having me on. Thank you. It feels an honor to close out your season 3.
Yes.
With the pelvic floor stuff.
Yes. Oh, thank you so much. Yes, it is the end of season 3, and we're taking a little bit of time off for self-care and bringing you new and exciting things to come in season 4. So make sure you check out the Academy of Pelvic Health if you feel like you might be having some issues. And feel free to reach out to us here or to, and I'll pass on anything to Jen if you have any questions as well.
Yes, happy to. If somebody is listening to this and they have questions but don't feel comfortable talking to maybe their provider, Michelle has my contact details, and I'm happy to help in some way.
Yes. Always happy to help here at Look Down There.
Yes.
So remember, you can like and love and subscribe, tell your friends, listen on road trips. This is a good time. And lots of road trips coming up for the summer.
Yes.
I don't know. Maybe. Who knows about gas? I don't know. Anyway, thank you so much for listening for these past 3 seasons. This has been so much fun for me to do. This is definitely a passion project of mine, and doing it all for the love and connecting with you all and amazing people like my guest here today, Jen. So thank you again for listening. Follow us at I Look Down There or me at Michelle Amore. And remember that confidence comes from the bottom up. So grab a mirror and look down there. Till next time.